Hi, welcome to the Durian Heat, where we discuss critical issues from Southeast Asia. My name is Grace Cho. If you thought your hands show your age, take a look at your neck. That old gobble excess of skin is one of the hardest to fix, as it's an area we exercise the least. Think about it. It's perhaps our least favorite body part. You know, the sagging skin under your chin that ruins the good photo, destroys your profile image, and perhaps you'll be screaming gobble gobble. So at Durian ASEAN, we have Dr. Choon, who is the director of MJ Skin and Laser Clinic, to tell us how to transform our turkey necks at the Durian Heat.
The Durian Heat, bringing big ideas and critical opinions in Southeast Asia.
We all know what flappy neck is, but what is it exactly and how does it happen?
Okay, flappy neck is one of the most common things that's seen in the aesthetic clinic. Besides the eye area, I think the neck area is another area that is seldom seen or is overlooked by a lot of people. As you know, a lot of people, we always focus on the face and the body, and the neck is always missed out. Actually, the neck is quite important. As you age, you have this thing called as the facial descent, the descent of the facial envelope. Because your skin start to sag, you lose collagen, you lost elastin tissue. At the same time, those which are a little bit heavier, for example, they are a little bit more fat in the face. The fat does also pull down the facial tissue or the facial skin, so resulting in a turkey-like neck, as you said earlier.
I mean, this happens with aging, especially, like you mentioned. But it is also often left out in the beauty regime. Like you mentioned that people often focus more on the face. How would you elaborate more on this? Because there are some cosmetic products as well to apply on the neck as well. But again, perhaps it's also the advertisement on the media side that there has not been so much focus on the neck rather than other parts of the body.
Yes, you are right. I mean, you just look at the amount of skincare there is in the market, the advertisements and things like that. So much on the face, the neck is usually a bit left out. But nevertheless, there are also cream for the necks.
I see.
People are more focused now because people expand. When you see the face, then what is next? A little bit below it. I'd like to stress that you can actually prevent some of these aging effects, or you can actually do some exercises like exercise of the neck and facial muscles, like moving the muscle against resistance. Very simple one. If you just put a thumb under the chin and then try to force your head down, you actually try to activate the muscles in the neck, the platysma muscle, for example, and this would really help prevent the effects of aging. You might delay it. At the same time, you should also try to eat healthily. You should eat food that has got, like, for example, beta carotene that helps in the cell turnover for our skin. So this will actually help prevent this from occurring. Another thing that we should always look at is some of the lifestyle. For example, smoking. Smoking actually destroys your collagen and your elastin fibers rapidly, besides the other harmful effects.
Right.
And you can also hydrate yourself. Hydration is really, really important, not only in the skin of the neck, but in the skin of your whole body and health in general. Use some sunblock, and then have enough rest. These are some of the lifestyles that actually applies not only on your neck, but health in general.
Doctor, you just touched on all this general part of how we can take care of ourselves. And I'm sure most of us, we are aware of perhaps when it comes to lifestyle, taking care of our diet and so on. But again, when it comes to the neck part, it is I believe it's also the most difficult part of the body to deal with when it comes to certain issues, I guess.
Yes, Grace, you are right. When it comes to the neck, oftentimes it's overlooked. That's why by the time the patient come to us, they are really actually like having a bit more serious issue.
I see.
Okay, the skin are really loose. There are wrinkles around the neck, and then some people have fat. So actually, the neck and the jaws, which is the side of the face, are actually quite closely related. We normally treat them at the same time, and there are a lot of methods to treat the thing. It's a surgical and also non-surgical. Maybe we can talk a bit about that also.
Sure. So we'll continue this conversation after this short break. Gonna talk more on the protection and also treatment when it comes to turkey neck.
Hi, I'm Dr. Michael Epstein, and I'm going to answer a question that was posed to me on RealSelf. This question reads as follows. What is the least invasive way to fix my sagging neck and double chin? And actually, there's a photograph of the patient that is attached to this particular question, and it shows, from the best I can tell from the pictures, is that the patient has some redundant skin and also some excess fatty tissue in the neck, and it looks like the skin is a little bit lax. In other words, it's sagging, and when I see a patient, first things I have to do is evaluate not only the skin but the underlying soft tissues to see if there's an excess of fatty tissue, to see what the quality of those tissues are, and to see if it's possible to do a minimally invasive or non-invasive type of procedure to correct the patient's problem. If there is not an excessive amount of redundant skin and or the quality of the skin is good, and there is not an excess amount of fatty tissue in the neck, then it may actually be possible to perform a minimally invasive procedure such as ThermI-RF, where radio frequency waves are inserted underneath the surface of the skin through a small little needle stick to cause actual heat to be applied to the undersurface of the skin and allow that skin and soft tissue to contract. But the patient has to be the right candidate for it. From what I can tell from the pictures that I see here, it looks like there's a little bit more going on than that, and that she's going to need some type of a neck lift. There are a number of different types of neck lifts that can be performed, and it really depends primarily on how extreme the problem is. To better identify what type of neck lift would best suit this patient, the patient would have to be examined by the plastic surgeon, and then it can be better determined as to whether or not she's going to need a full neck lift, a facelift, or just even a small submental neck lift where an incision can be just placed underneath the skin. But in my estimation, she is going to need a little bit more than a minimally invasive procedure to correct this problem.